Well, Peter, thanks very much for being with us. Just for so people know, I'm Senator Bob Casey, and I'm with Peter Morley. And Peter has spent most of the last number of years of his life being a strong voice for quality, affordable healthcare, and especially for the protections that every American should have for a pre-existing condition. And unfortunately, Peter's had to stay pretty busy these last couple of years because the forces that sometimes control Washington on the Republican side have been maniacally obsessed, and that's an understatement, maniacally obsessed with repealing the Affordable Care Act. They long ago, in my judgment, abandoned the idea of replacing it with something comparable. They just want to get rid of it. And now, after losing legislative battles, they want to use not just the Supreme Court by virtue of supporting a lawsuit to destroy ACA and wipe out all those protections for pre-existing conditions, but now they want to have a nomination process rushed through before Election Day so that that nominee will be on the Supreme Court bench when the November 10th lawsuit is heard, so that that nominee could vote and be the deciding vote on the overturning of the Patient Protection and Affordable Care Act. And Peter, I can't think of a graver threat to healthcare.
Senator, well, first of all, thank you for having me and discussing this crucial topic of healthcare. I've lived the life of suffering from an injury in 1997. Before the Affordable Care Act was implemented, I had an injury during a lapse of insurance coverage, and all the treatment and medication costs were paid out of my own pocket. And when I later needed surgery, my insurance company considered my injury to be a pre-existing condition. And all my claims were denied, and it cost me tens of thousands of dollars that I paid out of my own pocket. I mean, that wasn't that long ago. I mean, in 2007, I became permanently disabled from an accident, but I was spared the costly medical bills of 4 spinal surgeries because I had continuous health coverage. And, I've had so many different things and events happen to me. I had kidney cancer in 2011. I was diagnosed with lupus in 2013, and it's a disease that causes me severe fatigue, and most days it's a struggle to get out of bed. But I manage over 10 pre-existing conditions, and I take 38 medications, and I have to self-inject myself with 12 biologic infusions every week, to slow down the progression of my disease. And it's a very hard thing to say, but I live on the brink of financial ruin, and I only live modestly thanks to the fact that I can't be discriminated against because I have a pre-existing condition.
It's hard to comprehend for me to comprehend what you've been up against every day of your life. And we're just grateful you're willing to share your story and to continue to be an advocate for those who have similar challenges, but don't have the platform that someone like you has. And we're grateful you're willing to use that platform to help people without a voice. Nothing could be more important this year than the focus on healthcare, because so much is at stake for families, for young children, for older citizens, for people with disabilities, and people with chronic conditions and pre-existing conditions like you live with every day. So we just have to continue to make it clear to the American people what is at stake this year and what is at stake for the next several years, and to beat back and to defeat efforts to destroy what people like you have helped us build these protections in law so that you can continue to go forward and be the advocate you've been.
I appreciate that, because as unfortunately someone who spends the majority of my waking hours in doctor's offices, I would like to go back to focusing on my health and not against the sabotage that's being done by the administration and by GOP members of Congress who have tried to rip away these protections and destroy the Affordable Care Act.
Well, Peter, I have to ask, and this is a rhetorical question, obviously, but why would we ever go back? Why would we ever go back to a time when an insurance company, because they had the power to do it by law, to drop someone from coverage because of a pre-existing condition, or because they didn't want to continue to pay? Why would we go back to the days when an insurance company had the power in our country to charge someone more, to say, yes, we'll cover you, but because you have a pre-existing condition, we're going to charge you a lot more. There's nothing you can do about it. Why would we go back to those days?
I've been asking Republican offices that for the last 3 years, and none of them have given me a good answer. So,
well, and you know, a lot of people talk about this idea of Republicans having a replacement, that they're going to come up. The president has said a number of times, we're going to come up with something better. Well, last time I checked, they've had more than a decade to come up with it. And the reason why they haven't come up with anything that covers 20 million people, that has all the protections for pre-existing conditions, all the protections on annual lifetime limits, all the things that we now take for granted to a certain extent. The reason they can't come up with it because it doesn't exist.
Right.
There's no Republican whiz-bang plan, whiz-bang being a technical term, that is going to do what the Affordable Care Act does a different way and for less cost. It doesn't exist. It is a big Republican lie, and they know it's a lie.
Right.
I thought it was interesting that even in a big election year, they don't even have a platform. You would think that at least when I and others are accusing them of not having a replacement plan for a decade,
yes,
that maybe they'd come up with a platform for their election that would say, here's our detailed healthcare plan. Still waiting for it.
Yep, I'm still waiting for it too, but I know that you'll keep fighting for us in Congress, and thank you, Senator Casey, for being our voice and for fighting for people like me, the 135 million and probably much more than that with pre-existing conditions.
Well, to borrow a line from a song, Peter, thanks for being a one-man army. We really appreciate what you're doing to be an advocate for people who need your voice and depend upon voices like yours. And we're just so grateful that you're willing to share that much of your time. And we're going to win this battle eventually, or this war on healthcare, but we got to keep fighting. Thanks again.
I'll be in the fight with you, Senator Casey.